Hello, this is Chambisino Pharmacosis YouTube channel, where we make your life easier with the subject of pharmacology. So in the previous session, it was session number 2, where we covered about the different method for the transportation of the drug across the biological membrane. So today, this is session number 3, where we are going to cover about one of the pharmacokinetic parameter, which is absorption. So among of all 4 pharmacokinetic parameters, today we are focusing much on the part of the absorption. So before we proceed, I would like to invite you to join with us by clicking the subscription button below and let the notification on so that you will be updated whenever new content it will be uploaded in our channel. So let's start from this part of the absorption as one of the pharmacokinetic parameters. So for this case, as we said that we have 4 pharmacokinetic parameters. This absorption, distribution, metabolism, and elimination. So as you consider from this diagram that show briefly description for the pharmacokinetic parameter, once the drug it reach at the site of the administration, then it will reach into the systemic circulation through the process of absorption. So then it will reach into the systemic circulation. Then from the systemic circulation, the drug, it will undergo the distribution and reach into the tissue, but it will reach even the tissue which is responsible for the process of metabolism, including the liver. But that is not the case. It depends with the nature of the drug. If the drug it is hydrophilic in nature, then it will not be biotransformed. Then it will be eliminated directly in form of unchanged form via the kidney. But for the drug which is lipophilic, as I said, it will be distributed into the organ which is responsible for the metabolism. Here it is the liver, and then it will form the polar compound or polar metabolite that will be ready to be eliminated via the kidney as the primary site for the elimination of the drug. So for today, we are just focusing on the part of the absorption. Here, the way how the drug it is get absorbed from the site of administration into the systemic circulation. So for the acidic drug, if it is taken through the oral route, then it will be get absorbed via in the stomach, while the basic drug it is absorbed in the small intestine. So what we are focusing here, the way how the drug or movement of the drug from the site of administration into the systemic circulation, this process is called the absorption of the drug. So drug absorption, by definition, this is the movement of the drug from the site of administration into the systemic circulation. So because it is moving from the from the site of administration into the systemic circulation, then it has to close the biological membrane so that it can reach into the systemic circulation. And we know that this biological membrane, it is lipid in nature. So it is very important for the drug which is getting absorbed into the biological membrane to be lipophilic in nature. So the drug should be lipid in nature, so for it to be closing through the biological membrane. So because now the drug is closing this biological membrane from the site of administration into the systemic circulation, then there are different factors that can affect the process of absorption of the drug at the time when it is closing through the biological membrane. So here we are going to see different factors that affect the absorption of the drug. Number one, we are going to see those factors from the GIT, then the parenteral absorption, and the topical site when the drug it is applied in the skin, applied through the cornea, special treatment of the glaucoma, the mucous membrane. So we are going to see in detail now. Let's start with those factors that affect the drug from the GIT. So we have almost 9 factors. So we have the aqueous solubility, formulation, concentration of the drug, lipid solubility. We have the surface area, motility of the GIT, the presence of the other substance in the GIT, vascularity of the absorbing surface, and the ionization and the pH of the drug. So these 9 factors, these are the factors that affect the drug absorption from the GIT. So we are going to see in detail one factor after another. So for the factor number 1, which is aqueous solubility, for the drug to be absorbed from the GIT into the systemic circulation, the aqueous solubility of the drug, it is very, very important. But here, in this case, if you compare with the drug which is lipid, which is oil in solution, it is absorption for the oil solution, it will be poor in comparison with the drug which is in aqueous solution. So for this case, the drug has to undergo the disintegration and the dissolution to form the aqueous solution, then the aqueous solution will be absorbed. But in this case, we have some of the drug which is poor soluble in the aqueous form. For example, one of the antifungal drug called gisofuvin. Gisofuvin, it is poorly aqueous soluble. So to increase the solubility for this drug, it means you have to do some micronization, means reducing the particle size through the process of disintegration. Then once the particle size is removed, then its absorption, it will be more fast than when the granule, it is a sugar molecule. So for this case, you can see from this diagram, if you take the drug in form of the tablet, first it has to undergo disintegration into the stomach to form the so-called granule or small particle. Then this small particle, it will undergo the dissolution so that it will form the aqueous solution. Then the aqueous solution, it will get absorbed and reach into the systemic circulations. So that is all about the aqueous solubility. But we have another factor, which is the formulation. In case of the formulation here, we are looking most of the inert substance or the excipient which is incorporated during the formulation of the dosage form. For example, we have different excipient which is incorporated when you are formulating like the tablet. So we have those disintegrant, we have those glidant, lubricant, flavoring agent. So those agents that we are incorporating during the formulation, these have effect on the absorption of the drug. So they can enhance the absorption or they can retard the absorption of the drug. So here, it is mentioned some of them like lactose, sucrose, starch, calcium lactate. This may affect the absorption, and these are excipient for the fact that they are not active pharmaceutical ingredient. So here you can see this the capsule and the pellet formulation. So we have the gelatin material which is used during the formulation. So this gelatin material for the formulation of the capsule and the pellet, they have effect on the absorption of the drug. So it depending with the material which is incorporated, this it can fast the rate of absorption or it can retard the absorption of the drug. Another factor, we have the concentration of the drug. For this case, the highly concentrated drug, the higher the rate of the absorption of the drug. As you know, most of the drug, they are absorbed through the passive diffusion. So the concentration of the drug is very important because absorption, it is guided by the concentration gradient. So in this case, if you take the drug in form of the diluted form, the absorption rate, it will be less in comparison with the drug which is taken in the concentrated form. And for this case, also when you take the drug, for example, through the oral route, you have to take it with a few cups of water, because taking much water after taking the drug, it will dilute the drug in the stomach, and then it will prevent the absorption of the drug to reach into the systemic circulations. Apart from the concentration, also we have the lipid solubility. As we said, that the drug has to cross through the biological membrane. So for it to have easily way to cross through the biological membrane, the lipophilicity of the drug, that is very important. So the more the lipid solubility of the drug, the higher, the faster the rate of the absorption of the drug. But this lipid solubility of the drug, it should have the optimal level of the lipophilicity, because if you see the anatomy and the physiology of the biological membrane, they have the polar head which is present on the surface. This, it indicates that it is water solubility. So if you take the drug which is extreme lipophilic in nature, for example, the acyclovir, which is antiviral, if you see that it is extreme lipophilic in nature to the extent that it will not be able to pass through those polar head and reach into the systemic circulation. So lipid solubility is important, but it should be at the optimal level, not much lipophilic like the drug called acyclovir. So here you can see the drug which is lipophilic in nature is just passing through the simple diffusion across the biological membrane from the higher concentration to the low concentration, while those drugs which are in polar form, it will be restricted to pass through the biological membrane, then it will pass through the aqueous pores, which is located in the paracellular space. So the diffusion, it will not be possible. So lipid solubility, it will increase the absorption of the drugs. Apart from that, we have the surface area. So surface area is one of the factors also that can affect the absorption. So increase the surface area at the site of absorption, it will increase the absorption rate of the drug. So as here you can see, for example, we have some of the drug in the absorption of the drug in the stomach and the small intestine. In the stomach, some of the drug like aspirin, like barbiturate, we expect its absorption to be very high, especially in the stomach, but its absorption, it is less for the fact that in the stomach, the surface area is very small. So majority of this drug, its absorption, it is taking place into the small intestine, where the surface area in the small intestine, it is very high compared for the stomach, for the fact that there is a finger-like projection, the so-called vills. So this, it increases the surface area for the absorption of the drug. So we have to see now what are the villi which is present into the small intestine, where it will fasten the rate of absorption of the drug. For example, you can see from this diagram, this it indicates the small intestine, but if you see there is a finger-like projection which is called the vil, so this it will increase the surface for the absorption of the drug as the drug moving along the small intestine. So its absorption, it will be fast and it will be taken through the hepatic vein. So this hepatic vein, it will take the drug from the GIT into the liver for the process of metabolism. So these are finger-like projection, which is the vills, which increase the surface area. So on magnification, you can see this is the finger-like projection, which is the intestinal vil, which increase the absorption of the drug. So this vil or finger-like projection here, it is not present in the stomach. That's why majority of the drug, its absorption is very poor in the stomach, because of the small surface area in the stomach in comparison with the small intestine, where there is this vil which increases the absorption of the drug. So that it was the surface area, but we have another factor which is the motility of the GIT. So the GIT, when it is moving, undergoing those processes of peristalsis, so this it will affect the absorption of the drug. So for the drug to have extensive absorption, its motility, it should be at the optimal level or it should be less. So increasing the the motility of the GIT, this it will retard the absorption of the drug. So for this case, it happened that if you take two drugs, one of the drug has a tendency to increase the motility of the GIT, while another drug which is taken with that drug that increases the motility of the GIT, it means the absorption of the drug, it will be diminished for the fact that the motility, it will be very high. So if you can see this segmentation movement, peristaltic movement in the GIT here, this affected the absorption. For example, if you take the anticholinergic drug, this have a tendency to slow down the motility of the GIT. So once a drug is taken concomitantly with the anticholinergic drug, we expect the absorption of that drug, it will be very high, because the anticholinergic drug has a tendency to slow down the motility of the GIT. But we have some group of the drug which have a tendency to increase the peristaltic movement or motility of the GIT. This, it will retard the absorption of the drug. So this drug which tend to fasten or increase the motility of the GIT, including the drug like metoclopramide, the drug like domperidone, these are the drug that increase the motility of the GIT. So when it is taken along with another drug, this, it has a tendency to retard the absorption of the drug because of the. But we have another factor here, it is the mucosal damage. So once of the drug, there is some of the drug when it is taken has a tendency to cause the damage of the gastric, of the mucosa of the intestine. So this drug, it includes the drug like vinblastine, which is antineoplastic agent, zinc alkaloid, and also we have the drug like methotrexate. This causes the damage of the mucosa of the GIT. So by damaging the mucosa of the GIT, the absorption of the drug, it will be diminished. So that is one of the factors that you should be aware when you are considering the absorption of the drug. So apart of that, we have the presence of other substances in the GIT. So presence of the food in the GIT, this, it might delay the absorption of the drug. So for the fact that food, it can have a tendency to dilute the drug in the GIT. And you know, the diluted form of the drug, its absorption will be very less in comparison with the concentrated form. Also, food has a tendency to form a complex with the drug. So once it forms the complex, that complex, it will not be able to be absorbed. So the good example here, when the milk that contains the calcium, more you have a tendency to make the complex with the antibiotic, especially the tetracycline. So tetracycline absorption, it will be inhibited when it is taken along with the food, especially the milk. Another factor, it is the iron. Another substance, it might be the vitamin C. So vitamin C has a tendency to fasten the rate of absorption of the food containing iron. So if you want to increase the absorption of the iron, you have to take along with the vitamin C or along with the fruit like lemon. We know those fruit, they contain vitamin C, so it will fasten the rate of absorption. But also we have in the intestine, we said that we have the P glycoprotein pump, which have a tendency to inhibit the absorption of the drug by causing the efflux mechanism. So for this case, you have to take with another substance, for example, the grapefruit juice, which tend to inhibit the P glycoprotein pump and increase the absorption of the drug. So that is very important for this substance to put into consideration when you talk about the absorption of the drug. Apart from that, in the GIT, there is a possibility for the drug to be degraded. So there are different factors that can contribute to the degradation of the drug. So we know that in the stomach, we have the hydrochloric acid, which is secreted by the parietal cell. So there is some of the drug, they are acid labile, for example, the penicillin G. So this drug has a tendency to be degraded into the stomach by the hydrochloric acid, hence its absorption will not be effective. Apart from that, the drug can be degraded with the peptidase enzyme, especially those drugs which are protein in nature. The good example here, like the insulin. So insulin cannot be taken through the oral route for the fact that it will not be absorbed and it will be degraded by the peptidase enzyme in the GIT. But another factor is the some of the drug has a tendency to cause the degradation of the microbial flora. And we know this microbial flora, it's playing an important role for the absorption of the drug. For example, those drugs which have a tendency to go through the enterohepatic link cycling system. So in the stomach, there is the microbial flora, which have a tendency to cause the deconjugation of the drug, especially those drugs which undergoing phase 2 metabolism, which is the glucuronide deconjugation, and has a tendency to undergo the enterohepatic recycling system. So in this process, the drug, the bacteria in the GIT, it will cause deconjugation, and the glucuronide molecule, it will be excreted, while the drug, it will undergo the fate of the absorption. So you can see from this diagram here, if you take the drug via the oral route here, so the drug, it will reach into the ileum, where the absorption, it will take place via the hepatic, the portal vein, then it will reach into the liver. So once it reaches into the liver, it will undergo the phase 2 metabolism, which is called the glucuronide conjugation, and it will form the complex molecule, which is very huge to the extent that it will not be excreted through the kidney. Then it will be excreted through the bile, where it will be discharged into the duodenum via the bile duct. So once it reaches into the duodenum, then it will go into the small intestine, where there is a bacteria which has a tendency to cause deconjugation. And so this enterohepatic recycling system, it will not occur when the bacteria which is present into the small intestine, which is responsible for the deconjugation, has been degraded by some of the drug, especially those antibiotics, broad spectrum antibiotic, for example, chloramphenicol or the tetracycline. So this is all about the factor which is in this case, the presence of the other substance. Then we have the vascularity of the absorbing surface. So in this case, for the site of absorption to increase the rate of absorption, that region for the absorption, it should have highly vascularized, means highly perfused with the blood, so that the drug, it will be picked from the site of administration and reach into the systemic circulation, so that they can maintain the concentration gradient. So the less the vascularity, the poorer the absorption of the drug. And the higher the vascularity, the faster the rate of absorption of the drug. So as you can see here, the absorption of the drug into the GIT, it is very high because there is a different blood supply which tend to pick up the blood. For example, here you can see we have those mesenteric artery and the mesenteric vein that's supplying the stomach, the GIT. So this vascularity, it will increase and fasten the rate of absorption of majority of the drug. So from this here, Another factor apart from the vascularity, it is the last one from the GI, which is the ionization of the drug and the local pH. So what thing that you have to remember from this part of the ionization and the local pH is we have two classes of the drug. One group of the drug, it is non-electrolyte drug, which is considered the lipophilic drug, where it is absorption, it is along the concentration gradient. But majority of the drug, they are weak electrolyte. So it can be the weak acidic or weak basic. So it is absorption for this weak electrolyte drug, whether it is weak acidic or weak basic, it is pH dependent. But we don't have the drug which is strong electrolytes, and this is strong electrolyte, actually they ionize completely, but majority of the drug, they are weak electrolyte, means weak acid or weak base, in which it is ionization, it is pH dependent. So for this fact, it will be very important for you to know the site of absorption, the medium which is available at the site of absorption, and whether it is acidic or basic, and the nature of the drug that you are taking, whether it is a weak acidic or it is a weak basic. So when we talk about the ionization, we consider the drug which is acidic drug like this one here. So in this case, as the drug which is in acidic, it will undergo the partial ionization, whereby it will form the H plus and A. This is the drug itself, which is in form of ionized form. So in this case, for the absorption to take place, it is only the unionized form of the drug that absorption will take place, while the ionized form of the drug, it will be excreted. So ionized form, it will be excreted, while unionized form of the drug, it will be absorbed. So if you see from this equation, you can this ionization, it is explained well by one of the equation called the Henderson-Hasbech equation. So from this equation, it shows that the pH of the drug is equal to the pKa plus log of the ionized drug, concentration of ionized drug divided by the concentration of an ionized drug. So based on this equation, you can predict the pH and the nature of the drug, whether it is absorption, it will be fast or it will be slow. So it happened that if you take the drug, it will ionize 50%. So if 50% of the drug ionized, it means 50% it will remain unionized. So it is only the 50% which remain unionized that will be absorbed. So if that scenario it happened, meaning that this ratio, because it is 50-50, then it will be equal to 1. When you read the log 1, this log 1, it will be equal to 0. So this, it indicates that the pH, it will be is equal to pKa. So this is very important for to understand. So for this case, if the pH is increased by the factor 1, so you can increase the pH by factor of 1 for the fact that if the concentration of ionized drug will be higher than the concentration of an ionized drug, then you can increase by factor of 1 if the concentration of ionized drug, it will be less than the concentration of an ionized drug. So for this fact, as we have said, most of the weak electrolyte, it will be excreted if it is in the form of the basic medium. So for the weak acidic to get absorbed, it has to be in the acidic medium. The same applied for the weak basic drug to be excreted, it should be in the form of the acidic pH, and the weak basic, it should be in the basic drug to be absorbed. So you can see now from this fact, if the drug has the same nature as the medium, so this it will fast the absorption. But if the drug has different nature with the medium, this it will fast it will increase the excretion of the drug. So that is very very important. And you can ask maybe, what are the importance of understanding this ionization of the drug? Because this it will help you to know the site of absorption. So you can know that, for example, in the stomach, you know there is hydrochloric acid which is secreted by the parietal cell. So by understanding that there is a low pH in the stomach, it means you can know which group of the drug will be absorbed into the stomach. For example, here, because of that fact, it means acidic drug, especially aspirin, barbiturate, these are the drugs which highly exist in highly unionized form in the stomach, where the absorption it will be more. But for the basic drug, it will get an ionized form in the small intestine, where its absorption, it will be very fast in comparison with other part of the GIT. So understanding the ionization, it will help you to know the site for the absorption of the drug. But it will help you to know the concept of ionic trapping. So consider this is the small, the esophagus, and this is the stomach. So I'm interested with the part of the stomach. So this is the gastric cell, and inside here there is a parietal cell. So here we said that there is acidic. So because of the acidic, if you take the drug which is acidic in nature, so it will remain an ionized form. Because it will remain an ionized form means absorption, it will be faster. So it will reach inside of the cell, inside of the gastric cell. There is a high pH. Because of the low pH, high pH, and the drug, it is in form of an ionized form, then it will get ionized inside of the parietal cell, and it will fail to escape from the gastric cell and reach into the blood vessel. For example, this is the blood vessel. The drug has to escape from the gastric cell and get absorbed into the systemic circulation. But because of the basic pH, which is present inside of the gastric cell, then the ionized form of the drug, it will fail to escape from the gastric cell and reach into the systemic circulation. So it will be trapped inside of the gastric cell. This is called the ionic trapping. So you can see here, most of the drug, they will be an ionized form, especially when it is in the gastric because of the acidic pH. But once they reach within the cell and the pH, it is in form of alkaline. So this drug, which is acidic, it will get ionized. So it will not be able to escape from the blood. And this concept is called the ionic trapping, and it explained very well, especially for the drug which has those drug, for example, the aspirin, they cause the peptic ulcer because of this concept of ionic trapping that is happening. Then in some individual, when they take this, the aspirin, you end up getting the aspirin-induced peptic ulcers. So the same concept which is explained here, the pH here is very low, so the drug will remain ionized. Because of an ionized form, it will be able to cross the biological membrane. It will reach inside of the gastric cell where there is a basic pH. So this unionized drug, it will completely get ionized form. So the ionized form of the blood here, it will fail to escape and reach into the blood to get absorbed. So this whole drug which is ionized, it will be trapped inside of the lumen of the inside of the gastric cell. This can induce the peptic ulcers. So also ionization help you to understand the urinary pH for the excretion. So you can know that whether the acidic drug are excreted faster. So the acidic drug, it will be excreted faster when the alkalization of the urine, it will taking place. And the basic drug, to increase the excretion, you have to make the acidification. So you need to know what are the substances that can be used for the alkalization, and what are the substances, for example, sodium bicarbonate, and what are the substances that can be used for the acidification, for example, ammonium chloride. So it is very important for you to understand, because this concept, it will be helpful for you when someone has got the poisoning. For example, if someone has taken the barbiturate poisoning, so then the parent come with his son that the doctor, you as a doctor, you have to save that son. So how can you save for that? It means you have to know firstly the nature of the drug that the son has administered. Then by understanding the nature of the drug, then you can remove that drug for by either alkalizing or by acidifying the urine, which will increase the diuresis. So that is very, very important. So that was all about the factor that affected the absorption of the drug from the GIT. So we can see now for those drug, the absorption, the factor that affect in case of the parenteral absorption. So most of the drug which is taken through the IV, it will reach direct into the absorption, it is bypassed. So there is nothing will affect the IV absorption, IV administration of the drug. But if you take the drug through the intramuscular or subcutaneous, this it is very common, especially for the drug which is highly lipophilic in nature. So for this case, you know, in case of the muscles and those peripheral, the peripheral compartment, vascularity, it is very poor. So the flow of the blood, it is very poor. So for this fact, it means it is absorption, it will be very, very, very slow. And most of the drug which is taken in this case, we said that it is lipophilic, and it exists in the form of the suspension and the colloidal preparation. So also the blood flow, we said that it is very poor, but for this fact, there is a way you can increase the flow of the blood by either increasing or by applying the heat, or you can massage the site of absorption. This you can increase the absorption of the drug. But also there is other substance when it is taken with along with it has a tendency to cause the vasoconstriction. For example, if you take the adrenaline, this vasoconstrictor. So when it is taken along with this IM or subcutaneous, this it will cause the vasoconstriction, and then it will retard the absorption of the drug. So it is very, very important, especially for the drug which is prepared in the form of the depot preparation, to sustain the release action of the drug. For example, for the drug like the benzathine penicillin, which is most useful for treatment of the syphilis. Also for the drug like the protamine zinc insulin, which is prepared in the form of the depot preparation, it is commonly taken through this route, IM or subcutaneous, to sustain the release action of the drug. So we say there is a sample of the preparation which is taken through subcutaneous or through the intramuscular. It is incorporated with the substance which induces the vasoconstriction. So if you can see from this preparation of lignocaine, which is local anesthetic drug, which is used the most commonly during the tooth extraction, it is formulated in a fixed combination with the adrenaline. So adrenaline, the fate of adrenaline here, it is to localize the local action of the lignocaine, but also to, once they cause the vasoconstriction, it will prevent the bleeding after tooth extraction. So this concept is very important for you as a doctor, as a pharmacist, or as a physiotherapist, or as any medical healthcare provider. So that is very important to understand. And here we said that for the drug which is taken through the IV, this drug, it will reach directly into the systemic circulation. For example, this is intravenous absorption. But for the drug that will be taken through subcutaneous or intramuscular, this it will be affecting the absorption rate. It will not be 100% as the IV because of the different factors that affect the absorption of the drug. Then we have another factor, which is the topical, meaning applying the drug through the skin or applying the drug through the cornea mucous membrane. So for this case, there is a possibility that you can apply the drug through the intact skin, meaning in the topical, but you find that it mediates the systemic action. So it has a capability to penetrate through the intact skin. So this is very common for most of the preparation, which is considered as the transdermal patches or transdermal route of drug administration. So here we have some of the drug like the hyoscyapolamine, which is used for the motion sickness. Also we have the drug like nifedipine. Also, we have the drug which is used applied topically, like the nicotine, which is used for the sensation of the cigarette smoking. So these are just a few number of the drug which is applied topically on the intact skin, but it is capable to penetrate the intact skin and mediate the systemic action. So that is all about the in case of the drug which is applied through the topical. For example, here you can see topical application, but it will penetrate and reach into the systemic. And for the drug to penetrate, it will depend with the site of application. It means the nature of the skin. Also, it is one of the factors. Also, apart from that, as you can see, some of the drug, it is applied through the mucous membrane. For example, if you apply the drug through this region, you applied it topically, but it will mediate the absorption and reach into the systemic circulation. While some of the drug, it is applied, for example, those drug which is used in treatment of the glaucoma. So some of the drug, for example, physostigmine, it is used in the glaucoma. It is applied on the topical through the eye drop, but it can mediate the systemic action. That's why we use most case the physostigmine rather than neostigmine, because neostigmine, it is hydrophilic, is not lipophilic, so it will not be absorbed. That's why we prefer physostigmine for the topical application. Apart from the physostigmine, also we use, there is one of the beta blocker, which is called the timolol, which is very useful in treatment of the glaucoma. So you can find that you apply it in case of the ear drop, but it can cause the cardiac effect because of affecting the beta adrenergic receptor, but it can precipitate even the so-called bronchial asthma because of the effect that is mediating through the beta receptor into the respiratory system. So that is very important for this case to understand. And if it is applied the drug into the mucous membrane, for this case, you can find for the drug like estrogen cream, which is applied intravaginally. So it is applied intravaginally, but you can find that it is causing the gynecomastia in the male pattern. So this because of this the topical application or through the mucous membrane in the penis during the sex. So the drug it will get absorbed into the male penis and it can induce the gynecomastia. So you can fast the absorption by rubbing to the site or incorporating with the oleaginous base, or we do this the so-called occlusive dressing to or hydrate the skin that will increase the absorption of the drug. So another factor is that I would like to discuss here on the part of the absorption. It is the bioavailability. So bioavailability, this is the fraction of the drug that reach into the systemic circulation after the absorption, that reach into the systemic circulation in an unchanged form. So for this phase, if you take the drug via the oral route, so taking the drug via the oral route, it will be absorbed. For this case, it will be absorbed via the membrane which is present, the gastric membrane, which is gastric mucosa in the GIT. Then it will be taken by the portal vein and reach into the liver. So from the liver, then it will be taken via the hepatic vein, where it will reach into the systemic circulation. So for this case, what we are focusing is the concentration of the drug or amount of the drug that will reach into the systemic circulation in an unchanged form. So different drugs have different bioavailability, and it will be affected also by the nature of the route that you administer the drug. As we said that for the drug that will be taken through the intravenous, it is the bioavailability, it will be 100%, while the drug that will be taken through the oral route, it means during the process of absorption here, some of the drug it will not be absorbed. So there is some percentage that will lost. And once it reach into the liver, there is a first pass metabolism that will occur, then it will reduce the amount of the drug. So you can find that for those drugs that are undergoing extensive first pass metabolism, the amount of the drug that reaching into the systemic circulation, it is very, very, very small. So for that, you have to opt for another route of drug administration rather than the oral route. So if you see, for this case, we said that in case of IV, it is 100% bioavailability, but for the oral route, it is bioavailability will not be 100%. There are two factors: incomplete absorption and the first pass metabolism that occurring in the liver. So for IV, it is bioavailability is 100%, but for other route, it is absorption, it is less than 100%. So that is because of the factor that are affecting the absorption during the process of absorption, and the drug, if it has a tendency to pass, has a tendency to have that first pass metabolism, it will undergo the first pass metabolism in the liver, where its bioavailability will be much lower. So you have to know the way how to calculate the bioavailability. So for this case, we use the intravenous administration as a reference in calculating the bioavailability of the drug. For example, the first curve here, it indicates it is the plasma concentration time graph for the IV drug. So it means it will be highly absorbed immediate after injection of the drug. Then it will be keep on increasing in the plasma concentration because the drug it will be eliminated in the process of distribution. So this it indicates the IV graph. But also there is you need to have also the oral route of the drug. This oral route, this is the second graph here that shows the oral route of the drug. So it will start slowly concentration of the drug, and slowly it will be increasing. Then it will reach the peak or Cmax, and then it will start increasing the concentration because majority of the drug it will be eliminated, metabolized, and undergo the process of redistribution. So for this fact, this graph it indicates the oral route of drug administration. So you can calculate the bioavailability from the formula of area under the curve. Bioavailability is equal to the area under the curve of the oral route and the area of the under the curve of the IV route, which is the reference, times 100%. But how can you get this area under the curve? You can calculate area under the curve through this formula. So you can substitute your data because you will be recording those time and the concentration then you calculate the area under the curve at each time interval, then you sum up the area under the curve in each route of drug administration, then you just plug to the equation for the bioavailability, then you end up getting the bioavailability of the drug. So by understanding the bioavailability of the drug, you know that there is a different drug, it is manufactured from the different, the same drug, it can be manufactured from the different company, then it is given the same name. So we have the concept of the trade name of the drug. So there is different trade name which is formulated in the same dosage form, same strength, will have different bioavailability. So when the bioavailability of the two brand name is less than 20%, then this is called the bioequivalence. So for example here, the drug called phintoin. So phintoin, it is marketed under the brand name of the dilantin and eptoin. So this drug, if the bioavailability of this drug, which is prepared in the same drug, the same dosage and the same dosage form, if it is less than 20%, this is called bioequivalent. But this, if the different bioavailability, it is more than 20%, this is called biological inequivalence. So that is very important to understand in this part. So thank you for watching. And this is all about the part of absorption. Don't forget to subscribe our channel, like, comment, and you have to put the notification button on so that you will be updated when a new content it will be uploaded. So thank you very much. Welcome for the next session.